At university hospitals, we have a lot of experience with telemedicine. For many years, we've provided telehealth video services at many of our rural health clinics so that patients don't have to travel. And we've done this for primary care as well as general specialties.
We want to keep you safe and out of the acute care settings, which is emergency rooms and the hospital settings. And the more that we can interact and the more that we could focus on your care, the more that you can focus on your care. And as a team, we could actually improve your health and improve outcomes and facilitate necessary care and necessary live care more specifically and quickly.
The majority of what we do in person, we can still do over a phone or over a computer. For example, we can ask you to shine a light in their mouth. We can get a fairly thorough throat exam. We can see the way they're breathing. We can watch how their skin looks, not only in terms of rashes, but in terms of, are they well perfused? Are they pumping blood the way they should? Do they look pale? Do they look like they're in distress? We can watch them walk. We can watch them jump. We can watch them move different muscle groups or joints. We can truly do just about every system in one way or another, just using different tricks. Just like I use different tricks in the office to see a child and get them to cooperate with an in-person exam, we're finding newer strategies that help those kids get the same quality of care through the virtual care platform.
When we're doing telephone visits or video visits during this COVID-19 crisis, the way we're doing it as clinicians is we're setting up our workstations in the same way that we would when we see you in person. So we're able to review your medical record in advance. We're able to see your testing, whether it's x-rays or echocardiogram, able to see your lab results by the computer. So we really get a tremendous amount of information that already exists about you through our medical record. We're able to share that with you.
Your doctor's been planning for your telehealth video visit, reviewing all of your medical records ahead of time to make sure that this visit would be about monitoring your health conditions, refilling medications, answering any concerns that you have, and doing the kind of assessment that they can do during the video visit.
The reason we had to use telehealth is what's going on in the world right now with coronavirus. I actually was my first experience of it with Dr. Soika, and I actually absolutely loved it. I would reassure people this is very, very, it's not scary. I felt very comfortable, extremely comfortable. I had no questions, no thoughts after I got off the phone with her. Did I forget something? Did she forget something? Nothing at all. Everything was thorough. She made sure I was okay with everything, and I made sure she was okay with everything.
This is not a mutually exclusive situation. You don't only get virtual or only get in person. This is all about a spectrum of how we can treat your child best. So when you call your pediatrician's office and you talk with them or their staff, and they say to you, I think this could be handled virtually, we always have the option to shift it to an in-person visit if we need to.
As always, if there's some reason that your doctor feels that you need to have a test or a procedure, or you need to be seen in the office, they will advise you.
While doing a video visit is not the same as seeing you in person, I think that we can still accomplish a tremendous amount of things to help you. And I'm very certain that we can deliver high quality care.